Hello, my name is Michaela. This is my final for advanced health assessment. I will be doing my head to toe. I just want to point out, prior to this assessment, I did my vital signs and my history on the patient. And then throughout the assessment, I'm going to actually incorporate my cranial nerves in, just because it overlaps with some examination techniques. So first, I'm just going to begin with the skin. I'm going to look overall. I note that he's like a pinkish tan. He has appropriate hygiene. I'm just going to palpate as well. And he is warm, soft, dry. Palpate lower extremities. I'm also going to note there's no hair loss or atrophy in his lower extremities. Next, I'm just going to palpate for any edema or crepitus in his arms. Okay, I'm just going to palpate for edema down here. And I'm not seeing any edema. Okay, next I'm just going to check for skin turgor right behind his neck here. Okay, and overall, I'm not noticing anything open, no lesions, no abnormalities. Do you have any tattoos?
Yeah, one on my inner bicep and one on my shoulder.
Okay, and any scars?
One on my forehead and one on my arm and another one on my arm.
Okay, the only other thing I'm noting is that he has freckles on the bridge of his nose, but that is normal. Next, we'll be moving on to his fingers. I'm just going to assess his capillary refill and for clubbing. So I'm just assessing the capillary refill. And capillary refill is less than 3 seconds, and it looks like it's bilateral. Next, we'll be doing the clubbing test, which is Shamrock. I'm just going to have him put his 2 nails together to see if there's a gap. Okay, and the test is appropriate, so there's no evidence for clubbing. Next, I'm just moving on to his hair, his head, and his scalp. So I'm just going to palpate overall in the back here. And I'm noting that his hair is a dark brown with even distribution. I'm not seeing any lesions, no lumps or bumps, nothing open. I'm not seeing any head lice. His hair is evenly distributed, and no redness on his scalp. I'm just going to go ahead and move on to his face.
I didn't get that. Could you try again?
Next, I'm just going to move on to his face. I'm going to note that his eyebrows are also evenly distributed, and so is his facial hair. I'm not seeing any asymmetry on his face, which might indicate a stroke. I'm just going to go ahead and palpate his frontal and maxillary. Let me know if you feel any tenderness. Any tenderness? Okay, I'm going to do his mastoid process. Any tenderness?
Nope.
Okay, and we'll do his TMJ. I'll just have you open and close your mouth. Okay, I'm not noting any crepitus there. While we're here, I'm just going to test cranial nerve number 7. So I'm going to have the patient smile and frown and puff out his cheeks. Okay, and so cranial nerve number 7 is intact. Next, we'll be moving on to his neck assessment. First, I'm just going to check his range of motion. Are you able to look left to right? Are you able to roll your neck as well? Okay. Patient looks like he has full range of motion in his neck. I'm just going to be looking at his trachea. I'm noticing that it's symmetrical. I'm not seeing it pulling to either side. I'm just going to go ahead and palpate that now. Okay, and I'm not feeling any abnormality. Just going to have you swallow while I watch. Okay, and then I'll be checking his thyroid around the back. Okay, got it, swallow? Okay, and it was symmetrical. Next, we'll be moving on to his lymph nodes. So I'm just going to go ahead and palpate them. So I'm going to feel the preauricular, postauricular, occipital, submandibular, submental, sternocleidomastoid, anterior cervical chain. I'm going to feel for the posterior cervical chain. And then I'm going to feel for the supraclavicular. Okay, and I'm not noting any lymphadenopathy in his head or his neck. Next, I'll be just listening for bruits in his temporal artery, his thyroid, and then over his eyes. And I'll be using the bell of my stethoscope. Just go over your eyes. Okay, I'm just gonna have you hold your breath. noting any bruise in any of those assessments. Next, I'll just be moving on to our vision examination. So the first one I'm going to be doing is the Snellen chart, which will be testing cranial nerve number 2. So I'm just have the Snellen chart that's about 20 feet away, best we could. So I'm just going to have him read the lowest line he can.
LTFPH.
Okay, and that would be 20/20 vision. Next, I'll be moving on to the confrontation test. So I will just have him cover one eye, and I'll be checking his peripheral fields by wiggling his fingers, and I'll ask him to just let me know when he can see them.
No. No. No.
Okay, we'll have to switch sides.
No. No. No.
Okay, next we'll be doing the cover on cover test. So I'm gonna focus on pointing this direction, and I will just have him, I'll just cover up, and we'll switch sides. Okay, and it was appropriate. Next I'm just gonna be moving on to my pen light exam. So first I'm just gonna be checking for accommodation. So I'm gonna have him look at a point that direction, and I'll have the pen light pointing around his nose area. And I'll just have him look at the pen light. Okay, and his eyes appropriately accommodate to light. Next, I'll just be checking for his pupil size. Look straight forward just like before. Okay. And they constrict appropriately. They're about a 3 bilaterally. And they are even. I'm just gonna do the cotton test. And this, with the cotton test, it will actually test cranial nerve number 5. So I just need to look forward. I'm checking his blink. Okay, we'll do this side as well. Okay, and then another test for cranial nerve number 5 is I'm just gonna push against his jaw, and I want him to try to open. Perfect, and cranial nerve number 5 is intact. I'm gonna do the 6 cardinal fields as well. So I'm just gonna have him follow my finger. And with this test, we'll be testing cranial nerve number 3, 4, and 6. I'll just have you follow my finger in all the directions. Okay, and all those cranial nerves are intact. Next, I'll just be using my scope to examine his eyes. So first I'm gonna look without, and I'm just gonna see that his sclera is white, his lacrimal glands are pink, his conjunctiva is pink. I'm gonna go ahead and grab my scope and connect my top piece. And I'll just have you take off your glasses, that way you don't bump them. Okay. Now I'm just gonna view it on the other side. Okay, and I noticed that his blood vessels were all present, all the branches. His macula was even. His optic disc was present as well. Just make sure we don't forget any tests. Next, we'll be moving on to the ears. So overall, I'm just going to look at them. I'm going to palpate as well. I'm not feeling any nodules. They're appropriate size, they're appropriate length, and especially from his inner canthus. I will be moving on to test the inner ear with my otoscope. Okay. So in the auditory canal, I'm not seeing any foreign bodies. His tympanic membrane's like pearly pink, gray. Just gonna test the other side. Noticing a bit of cerumen. Auditory canal is clear, and tympanic membrane is also a pink pearly gray. Next, we'll be just moving on to our hearing test. So the first hearing test we're going to do is the whisper test, which will also test our cranial nerve number 8. So I'm just going to have him cover one ear, and I will say some words that I want him to repeat back to me.
Apple.
Okay, and we'll do our other side.
Banana.
Perfect. Next we'll be moving on to the Rhines test and the Weber test, which we'll be using our tuning fork for. So the first one, I'm going to hit the tuning fork, put it over his head. I want you to tell me if you feel it symmetrically. Do you feel symmetrical?
Mm-hmm.
Okay. The next I will be hitting the tuning fork, putting over his mastoid process. When he stops feeling it, he'll let me know, and then I'll put it over his ear to see if he's still hearing it.
Okay, I stopped feeling it.
You still hear it?
Yeah. Okay, I stopped feeling it.
You still hear it?
Yep.
Okay. So test was appropriate to show that air conduction is 2 to 1 versus bone conduction. Next we'll just be moving on to his nose assessment. So first I'm just going to overall look, and I don't see any sort of deviation, any open wounds. I will be taking my pen light next. Just be looking in. You can shut your eyes if you want. Okay, I'm not seeing any deviations. Everything is appropriate in his nerves. While I'm here, I'm going to test cranial nerve number 1 with his smell. So I'm just going to have him keep his eyes closed. I'll have you cover one nerve for patency, and I just want you to tell me what the smell is.
Vanilla.
Perfect. And I'll do the other side.
Vanilla.
Perfect. Okay. Next we'll be moving on to his mouth assessment. So I'll be open up wide. All of his teeth look appropriate. They're in appropriate spots. Just gonna get my tongue depressor here. Okay, I'm noting that his tonsils are appropriate. I'm gonna have you say ah. Okay, and I'm just gonna test your gag reflex. Okay. So with those last two, the uvula rising was cranial nerve number 10, and his gag reflex was cranial nerve number 9. Next I'll just be assessing cranial nerve 12, and I'll have him stick out his tongue. Okay, and then I'll have you move it side to side. Okay, and it was symmetrical. There was no problems with movement. We will be moving on to his chest and lungs assessment. So overall, I'm just going to look at the patient. He doesn't look like he's dyspneic. He doesn't look like he's breathing rapidly. I'm not hearing any audible sounds without the stethoscope. I'm just going to palpate for any subacute crepitus in his chest. Okay, and I'm not feeling anything. Okay, no crepitus. I'm going to look at his anterior, his posterior, and his transverse, and they're all appropriate distances. First, I'll be moving on to chest expansion. So I'm just going to come behind him. I'm going to place both palms on his back, and I'll have him breathe in and out. Okay, chest expansion was even on his backside. While I'm back there, I'm going to go ahead and move on to his diaphragmatic excursion, which will be with percussion. So I'm just going to take a marker and a roller. Okay, and then I have you breathe in and hold it. Okay, gotta breathe out. I'll do the same thing, except I'll have you breathe out or hold it. Okay. And it's about 3 centimeters. Go ahead and measure. Okay. We'll do our other side. Okay, and do the same thing. Go ahead. Breathe in and hold it. Okay. Now we breathe out and hold it. measure this. Okay, and it is about 3 centimeters, and they're symmetrical. Next, we'll just be moving on to tactile fremitus. So I'm just going to be palpating him, and I want him to say the words 99 while I feel. So you can feel with your palms, you can feel it with your ulnar according to our textbook. So I'm going to be feeling with our palm, or I'll feel with the ulnar. Okay, go ahead.
99, 99, 99, 99.
Okay, I'm just going to feel around the backside. Okay, go ahead.
99, 99, 99, 99.
Okay, and it was appropriate on both sides. Next, I'm just going to go ahead and auscultate for his breath sounds. Okay, just going to have you breathe normal. Okay, I'll be doing the same thing on the back side.
Motion detector. Motion detector.
Okay, and I'm not noting any abnormalities or any abnormal breath sounds. Next, we'll be moving on to our cardiac assessment. So I'm just going to have the patient go ahead and lay back. Just feel if you like. Okay. So normally I would have some transgeminal lighting, and I would just be looking to see for any abnormalities. I'm just going to leave the sugar up here for a second. And I'm not noting any. Of course, I don't have that lighting. Next, I'm just going to go palpate. I'll start at the apex. I'll move along the sternal border. To the sternum. All the way to the base. Okay. And then I'm just going to go ahead and palp for the apical impulse as well. Okay. I wasn't able to visualize it, but I was able to palpate it, which would be the point of maximal pulsation. Next, I'm just going to have the patient lay on one side. I'm just going to be assessing for any heaves or lifts. Just going to lift your arm here. Okay, and I'm not seeing any patient assessments normal. I'll go ahead and lay back on your back. Next, I'll have you sit up actually. I'm just going to listen to his heart sounds. Okay. First, I'm going to listen with the diaphragm. Aortic. I'll be listening to pulmonic. Herb's point. Tricuspid. And mitral. Okay, this next time I'll be doing with the Bellarmine stethoscope. I'll have the patient lean forward a little bit and hold his breath, just to listen for any murmurs. and I heard no abnormalities, no murmurs, no splitting heart sounds, no gallops. Next we'll be moving on to the abdominal assessment. So first I'm gonna have the patient lay back. I'm just gonna lift his shirt up. So first I'm gonna have him lay supine with his hands down by his side. I'm not noting any abnormalities such as any hernias. Next I'm just gonna have you push yourself up actually. And I'm just gonna look at your belly while you're doing that. And I'm not seeing any hernias, anything protruding from his belly. I'll have you lay back down again. Next I'm gonna be listening to his bowel sounds. Okay. And I heard bowel sounds in all 4 quadrants. Next I'll just be percussing each quadrant, here, tympani, hopefully. Okay, percussion was appropriate. Next I'll just be palpating. First I'm gonna start with light palpation, then I'll move to deep palpation. And he'll just let me know if there's any tenderness or any problems. So my first and light palpation. Okay, and then we'll move to deep palpation. I'm gonna do it with 2 hands. Okay, any difficulties, any problems? Okay. Next, we will be moving on to palpation of his organs. So first we're gonna start with the liver. I'm just gonna first slide my hands up to see if I can palpate it. Okay, and I was unable to palpate the liver. Next I'm gonna be doing the Hook method, which I'll go this direction and slide my hands up. I'll be hold your breath for a second. Okay, and I am unable to palpate it, which is normal. Next I'll be doing the gallbladder, which is right next to it. And I don't palpate it, and do you have any tenderness? Which is good. Next we'll be palpating the spleen as well. I'm just gonna move right across. And I'm also unable to palpate this, which is normal. Next I will be measuring for the liver. So I'm just gonna percuss until I hear appropriate sound, and then I'll put a marking in. That way I can see the measurement of his liver size. Just gonna get my ruler and measure. Okay, and it's about 7, which is an appropriate size. Next I will be palpating for splenic dullness. I'm sorry, percussing. So I'm just gonna percuss over here. And it is appropriate, and next I'm gonna be palpating for gastric bubble, right near his epigastric area. And it is appropriately percussed. Lastly, I'm going to palpate for his kidneys, which is going to be similar to the spleen palpation on each side. Okay, I'm not able to palpate his kidneys. Okay. And then I will just be checking for venous return around his belly button. Okay, and he has appropriate venous return. While I'm here, I'm going to go ahead and listen for breathes as well. Okay. So I'm going to start with the renal. Aorta. Iliac. And femoral. Okay, and there was no bruise noted on my auscultation. Next I'm gonna have him sit up, and I'm just gonna assess for the costovertebral angle, just to see if he has any tenderness. So I'm just gonna percuss you lightly, so just let me know if you feel any tenderness. Any tenderness?
Nope.
No? Okay. Okay, next we'll be moving to blood vessels. So first I'm just gonna overall look at the patient. I'm gonna note he is not pallor. And once again, I'm gonna know there's no parts of his skin that are missing chunks of hair. His hair is evenly distributed. I'm gonna go ahead and palpate for his pulses. So I'm just gonna do, I would do dorsalis pedis. Anyway, socks on. Okay. And I'm actually still able to feel his pulse through. And it's a +2. I'm going to do his post-tibial. Okay, and then his popliteal. Feels radial pulses. Okay, we'll do his brachial. And lastly, I'm going to do his carotid. Okay, while I'm here, I'm actually going to listen to his carotid as well, make sure he has no bruise. So I'm just going to have you hold your breath. Okay, and no bruise were noted. Next we'll be checking for JVD, so I'm just going to have the patient lean back. You can lay on this. Go ahead, sir. Position the pillow under him so you've got that lift up one more time. He's about 45 degrees. Just gonna stick it. You gotta lay your head back. So I'm just gonna assess his neck. I'm not noting any JVD distension or jugular vein distension. Next I'll be moving on to pulsation and pulse wave. So I'm gonna go ahead and take my ruler and measure. So I'm gonna use this as a straight line as well. So I'm gonna see where this guy's pulsation is. It's about here. I'm gonna go ahead and measure. Which is about 6, which is normal. I'm gonna have you go ahead and sit up. Next we'll just be moving to our neurological assessment. So first test is the cerebellar. So all these are gonna be cerebellar. I'm gonna have him put his hands on his thighs and flip them, go back and forth. I'm not noticing any problems there. Next I'm gonna have him do his fingers to his thumb. Perfect. And then I'm gonna have him do his nose to my finger. Good, and all those assessment tests are appropriate. I'm gonna have the patient stand up. We're gonna do the Romberg test, so I'm just gonna have him close his eyes and stand still. And I'm not noting that he's swaying, he's not having any problem standing up. Open your eyes. I'm gonna have you walk just a little bit so I can assess his gait. Okay, and his gait is appropriate. His arm sway is also appropriate. While he's standing, I'm gonna go ahead and do the Trendelenburg test. So I'll have him lift one leg. Good, I'm not noting any weakness in his hips. Lift the other one. Perfect, you can go ahead and have a seat. Next I'll just be moving on to like the touch and the pain assessment. So I'm gonna be using soft cotton for the touch, and then for pain I'm just gonna pinch him a little bit. So I just want you to tell me if I'm touching you. Go ahead, shut your eyes. Am I touching you?
Mm-hmm.
Is it soft or is it pinchy?
Soft.
Okay, how about now?
Pinchy.
Okay, right. Let me go. Alright, am I touching you?
Mm-hmm.
Okay, am I touching you now?
No.
Okay. How about now?
Yes.
Is it soft or pinchy?
Pinchy.
Okay, and it was appropriate. Next we'll be moving on to proprioception. So I'm just going to take one of his fingers and have him shut his eyes. So I just want you to tell me the direction I'm moving your arm or your finger, okay?
Up, down, right, left.
Okay, perfect. Next I'm just going to be handing him objects, and I want him to appropriately name what the objects are.
A book.
Perfect.
A marker.
Okay. Next I'm gonna keep his eyes closed. I'm gonna touch you in a certain area, and I just want you to tell me where I'm touching you. Okay?
Hand. Shoulder. Shoulder.
Okay, so this next time it's gonna be my 2-point discrimination. I want you to just tell me if I'm touching you with 1 point or 2 points.
Okay. 1, 2, 2, 1, 2.
Okay. Next I'm gonna be doing the letters in the hand exam, so I'm just gonna have him flip his hand. I'm gonna spell out a letter. I just want him to tell me what letter it is.
R.
Okay.
B.
Perfect. Next we'll be moving on to our reflex test. So I'm just going to use my hammer. I'm going to start with the abdominal one, so I'm going to have him lay back. And I'm just going to stroke lightly on his abdomen. I'll stroke that first. And down. Okay, and the reflex was present with both, all 4 groups actually. Next I'm just going to be looking at his reflexes down here. You can go ahead and sit up. First I'm going to be doing the plantar reflex. Okay, and the next one. Okay, so plantar reflex was appropriate on both sides. Next I'll be doing his Achilles while I'm down here. Okay. Okay. We will do his patellar. Okay. Brachioradialis. Relax your hand. Okay. Okay. We will do your bicep. Okay. And then we'll do his tricep while he's here. And all deep tendon reflexes were present. Next test, I'm just going to see if he has ankle clonus. There's ankle clonus test, so I'm just going to take his feet. Just have you relax. Okay, and no ankle clonus is present. Next, we're going to be moving on to musculoskeletal, which is our last assessment tool. I'm just going to overall look at the patient. I'm going to note that his muscles are symmetrical, contour is appropriate, no dimpling in any area. I previously assessed already for swelling and crepitus and know that there is none. I'm just going to feel for any warmth over the joints. I'm not feeling any. And then first we're going to start with our hands and wrist. So first I'll just have you roll them, make sure he has proper range of motion. Okay. I'm just gonna go ahead and look at his joints on his finger. I'm not seeing any redness, which would be evidence for rheumatoid arthritis. He has all 10 fingers. He's not missing any parts either. I'm just gonna do an abduction test for carpal tunnels. I'm just gonna push against me. Perfect. Good. And everything was appropriate with his hands and wrists. Now still be moving on to his elbows. So I'm just gonna be bend up and bend down. I'll be push against me, bending up and down. Good. Full range of motion. I'm just gonna go ahead and palpate down, make sure I don't feel any fluid-filled sacs. Okay. The elbows are appropriate. Next, I'm just going to assess for cranial nerve 11. I'm just going to have him try to shrug his shoulders. Okay, and his shoulders have no problem. Contour looks appropriate. I'm not noting any dislocation or anything. We're going to be doing the NIRS test and the Hawkins test. So I'm just going to have him lift one arm all the way up. I'm just going to push against. Do you have any pain? No? Okay. Now we bring it in and rotate. Any pain? No? Okay. I'm going to have you lift your arm up. Good. Any pain? No. Same deal as before. I'm going to have you bring it in and rotate. Any pain? No? Okay. Next I'll have you stand up. Just going to be assessing his spine. Go ahead, turn around. Do you feel any tenderness?
No.
No?
No.
Okay. Now you bend forward, touch your toes. Okay. It's the appropriate line. Go ahead, stand up. And you can move side to side too as well. Okay. So he looks like he has full range of motion in his cervical spine and his thoracic spine. I don't see any curve, any scoliosis. I'm going to have the patient sit. Next, we'll be doing the straight leg test, so go ahead and lay back. I'm going to have you lift up one leg straight. Good. And no problems there. Go ahead, lift up the other one. Good. No problems there. Next, I'm just going to have you bring one leg up and bend it to your chest. Good, and no problems. And other side. Good. So next we'll be doing the Volokman test. I'm just going to palpate on his knees. I'm going to note there's no joints or bursitis. Okay. Next I'm going to have you bring your leg in. I'm just going to rotate it internally. Any problems? And outwards. Okay, we'll do our other one. Rotate in and out. Okay, and no problem. I'm just going to have you scooch forward. I'm just going to have you push against my legs. Okay, and the other one. Good, you can sit up. Lastly, I'm just going to assess his ankles. I'm going to note that there's no problems. He's able to do weight bearing and non-weight bearing, which we've seen with our test. Have you push against me? Good, and then the other way. Good. All right, and now we're under assessment.